Morning. It is a surgery day. It's about 6 a.m. I just got to the office. I'm going to get changed into my scrubs and then we're going to get ready for surgery, and I'm going to bring you all along with me for the day so you can see how a day of surgery looks. We do all plastic surgery, all cosmetic, and today we are doing a breast augmentation with silicone implants and a vertical lift on just one patient. So a nice routine day, one of my favorite surgeries actually to do. So let's get the day started. Okay, it's like 6:40. My patient just got here, so we're running a pregnancy test right now, which we do for all women of childbearing age. And while that is running, I am going to get a couple things done. We do a couple checks every surgery day. I have to check the crash cart, make sure everything's working, check the anesthesia machine, make sure everything's working, count my narcotics, things like that. So let's go do that.
Attach pads.
Just taken by the feeling. We were in Paris. Play me some Taylor. Such a good song. So good. So we have this cart that has all the anesthesiologist supplies in it, so I like to stock it every morning just to make sure they have everything they need. It has drugs, it has airway supplies, so whatever they need, it's probably in here. It's actually pretty well stocked, so I only need a couple of medications and we'll be good. Say hi, Eddie.
Hi, Eddie.
So this is the autoclave. Eddie is our tech, and he does literally everything that I don't do. So all the instruments, he makes sure everything's sterile. He makes sure Dr. Gray has everything he needs. So right now he's just getting some instruments prepared. I know. It's probably cold though. This is the OR all set up for the day. Nobody's here yet besides me and Eddie, so we just have everything wrapped still. We have a beautiful view, 23rd floor. It's a gorgeous day. Welcome. We're doing a breast case today, which means that we use a medication called Exparel. It's an injectable nerve block. So I prepare that so that Dr. Gray can inject it while the patient is under anesthesia before we cut. So I just need a few ingredients for it. It's saline, epinephrine, and Exparel, which is in the fridge. So I do that last second. I also make a syringe of antibiotics that we put in our fluid just for an extra layer of protection against bacteria. And then that's all I need for this case. I always label everything, even though I'm the only one that draws things up, and I'm the only nurse, but still, I always like to label everything just in case. So this one's going to be the Exparel. Exparel is 10 cc's. I just leave this one empty because I fill it up at the last minute because I pull it out of the fridge. So I will just label this as Exparel and then leave it empty. What? Okay, this one's going to be Ansep. Ansep is a powder in a vial, so I'm just going to reconstitute it with 10 cc's of saline. And then we're gonna put this in betadine and our saline solution. This is why I label everything, because things start to look similar. Okay, so we're using half a cc of epinephrine as well. I finished all my pre-surgery tasks, and now I'm just waiting for the anesthesiologist and the surgeon to get here. So I probably have 30 plus minutes, and I'm gonna do my Botox. I'm using Xeomin, which is another neurotoxin. It's my favorite. I'm leaving for Paris and Amsterdam on Sunday, so I need to re-up. These lines are out of control. So I thought it was a perfect time. So let's do that. Usually I use about 40 units on myself. I'll show you what I'm gonna do, but this will be better. There we go. Okay, so I'm gonna draw out my spots before I start injecting, so I know where I wanna go. Okay, so here's all the spots that I'm going to do my talk. So of course, frontalis, glabella. I'm gonna do my lateral eyes, my crow's feet, and then I'm gonna do a little bit of a Nefertiti and my platysmals. When I do talks on patients, not myself, I do use ice to just kind of help it make it a little bit more comfortable, but when I do it to myself, I don't have that many hands, so it's a little bit harder. So I just wing it. Ooh, these are the spicy ones. That is it, we are done. to try really hard to stay hydrated, especially when I'm in the OR. I just get too busy and I don't drink enough. So I'm gonna be really conscious about drinking today because I am leaving for my marathon in literally a few days. So I'm gonna drink at noon. Started the surgery, so they won't need me for a little while. I'm here if they do, but this is usually the time that I check my email to check on patients usually need refills for medications or questions, whatever. So I'm just gonna check my email for a little bit. Okay, when somebody gets breast implants, you have to document the serial numbers. So there are serial numbers and lot numbers associated with each implant. So we document this in the patient's chart in our own. We have a book of records for all our patients, and then I have to do it online to register with the implant company. And then the patient gets a card to go home with all the implant information on it. I haven't put the patient's name on it yet, but this is what it looks like. It has the date of your surgery, the doctor's name, and then your serial numbers. And this is important to have in case in the future you have any sort of an issue, or if you have a revision surgery, the doctor usually likes to know what you have in there currently. So this is just a good thing to like put away with your stuff, your documents. Yeah. Break, so I am about to just eat my lunch. It is an anti-inflammatory bowl is what the recipe calls it, but it's chickpeas, tofu, potatoes, spinach, carrots, rice, and then a homemade balsamic tahini dressing. Oh, there's also asparagus. So that's what I'm gonna have for lunch. The surgery is done for the day. It's about 3 p.m. Our secretary had to leave a little bit early today, so I'm just gonna check the messages before I go, make sure that nobody needs to be called back. And then I'm gonna go home. I am done with surgery for the day. I'm just getting in my car to go home. Hope you guys liked this video, this style video. Hope you learned something about plastic surgery or surgery in general. If you have any questions, leave them in the comments below and let me know if this is something you want to see more of. Okay, love ya.